Why do many candidates struggle with the Sonography Canada Core Sonographic Skills exam? After reviewing numerous candidate performance reports, I have noticed a common pattern. Most unsuccessful candidates do not fail because they lack memorization of ultrasound physics. They fail because they struggle to apply physics concepts to real clinical imaging situations. The core exam heavily tests cause and effect relationships, such as increase imaging depth. What happens to PRF? Increase transducer frequency. What happens to penetration? Increase damping. What happens to bandwidth? Increase Doppler steering angle. What happens to Doppler shift? These application-based questions form a major part of the examination. The most important fact many candidates overlook is that operation of equipment accounts for approximately 76 to 84% of the examination blueprint. This means weaknesses in equipment operation can outweigh strengths in almost every other domain.
The most common problem areas include Doppler optimization, image optimization, artifact recognition, beam formation, harmonics, focal zones, dynamic range, persistence, frame rate, color and spectral Doppler controls, and physics integration into clinical practice. Many candidates know the definitions, but struggle to predict what happens when a control is increased or decreased, and when it should be used clinically.
Another frequent weakness is technical analysis, including image quality assessment, identifying technical errors, selecting corrective actions, artifact recognition, and Doppler waveform interpretation. A useful exercise is to review an image and ask, what single adjustment would improve this image the most?
Core examination questions often follow this logic. Suggested study allocation: 60% equipment operation, 25% technical analysis, 10% self-protection, ALARA, TI, MI, bioeffects, ergonomics, 5% ethics, professional conduct, patient safety.
For every control on the scanner, ask, what happens when I increase it? What happens when I decrease it? When would I use it clinically? What problem does it solve? The candidates who pass are usually not the ones who memorize the most facts. They are the ones who understand how ultrasound systems behave and can make the correct optimization decision in a clinical scenario. For Sonography Canada exam preparation resources, mock exams, and review questions, www.sonographycanadaprep.com. Dr. Aaravudai Nambi, MBBS, DMRD, FRCR, radiologist, ultrasound specialist, ARDMS and Sonography Canada coach, founder, Fortune Academy of Medical Science.